Good morning, all of you. My name is Chand Praveen Nandev. I am from Jalna. I recently passed out my Bachelor of Pharmacy in Dr. Babasaheb Ambedkar Technological University, Loner Raigad. Today's subject is technical, and today's topic name is blood pressure. Blood pressure refers to the force of the blood excreted to the walls and your arteries. It is the circulate through your body, and it is critical indicator and cardiovascular health, and it is measured millimeter and mercury of the mmHg. The blood pressure is essential because of it ensures blood can flow through the arteries and to the deliver oxygen from the nutrient and to your organ and tissue while removing the waste product, the component of the blood pressure. Blood pressure is reading consists of two members. First of all is systolic blood pressure, and second one is diastolic blood pressure. The first of all, systolic blood pressure. This is the higher to all of representative the pressure of in your arteries when your heart is contracting and pumping blood. It measure force blood when the heart muscle is contracting phase systole. Normal range of around is 190 to 120 mmHg. Then diastolic blood pressure. Diastolic blood pressure is the bottom number. This is the lower value of the represent the pressure of the arteries with when it heart is resting between the brain and filling with blood. It measures the force of blood with the heart and muscle and relaxing phase dissolve. Normal range is typically around 60 to 80 mmHg. So typically healthy blood pressure is highly be 120 to 80 mmHg. The blood pressure categories. The American Heart Association AHA categorized blood pressure different range to help identifying potential health risk and normal less than 120 to 80 mmHg, elevated systolic between 120 to 129 mmHg, and diastolic is less than 18 mmHg. Hypertension stage 1 in systolic between 130 to 139 mmHg, and diastolic between 80 to 89 mmHg. Hypertension stage 2, the systolic is less than 140 mmHg and diastolic as less than 90 mmHg. Hypertensive crisis, systolic over 180 mmHg and diastolic over 120 mmHg. The factor influencing blood pressure: cardiac output, blood volume, etc. First of all, we see the cardiac output. This is the amount of blood the heart pump in the minute. The more blood the heart fewer pumps, higher pressure on all the arteries. Then blood volume. Blood volume is the total volume of circulating in your body. More blood in circulation can increases blood pressure. Then resistance of blood vessel. Narrow and stiff arteries increasing the resistance of blood factor flows and can be the blood pressure. Kidney function. The kidney is help regulate the pressure, controlling balance and the release of the hormones and regulate the blood pressures. Dysfunction in the kidney leads to the increased blood pressure. Then hormones and neurotransmitters. The several hormones like adrenaline and aldosterone and neurotransmitter after the blood vessels tone. The heart is fluid balance influencing blood pressures. Then next one, causes of high blood pressure: hypertension. Hypertension is a hypertension or high blood pressure. It is a common condition that can undergo is undiagnosed because often doesn't causes initially, and symptoms. The causes of hypertension include the primary hypertension. It is the most common of accounting for the 90 to 95% cases. The next causes known as the likely due to the combination of the genetic, environmental, and lifestyle factors. The secondary hypertension. This occurs of result another medical condition, each as kidney disease, sleeps, endocrine disorder, certain medications, for example, birth control decoctions. Then risk of high blood pressure. In untrained high blood pressure is lead to the severe as a complication, including heart disease. Heart disease, hypertension can causes damage heart leading to the conditions such as heart failure, coronary artery disease or the heart attack, etc. Then stroke is a high blood pressure, weaken body vessels, the brain, increasing the rise of stroke. Kidney damage, the damage is the can become damage due to the increase of pressure in the blood vessels, leading to the kidney disease or failure. Then vision loss, hypertension can damage blood vessels in the eyes, potentially leading to the by blindness. Then causes of low blood pressure, dehydration, then heart problem, then endocrine problem, blood loss, infection, and blood pressure medication, etc. Thank you for watching my video.